that we're here on Memorial Day weekend, or the kickoff of Memorial Day weekend. It's an important, solemn weekend for families, for the opportunity for millions and millions of Americans to come together across their differences, take time to reflect and remember those that sacrificed their lives for the cause we hold dear, and that's our freedom. Never to be taken granted, never to be forgotten, and it is appropriate, despite this pandemic and all the strife, the challenges, all the consternation that it brings, that we take this time together with our family and our loved ones to reflect and to remember. I know for our family, like so many others of you that are watching, this is an important weekend. My grandfather, Arthur Menzies, spent close to 5 years as a prisoner of war. He was in Corregidor and Bataan, and he struggled and suffered not only to survive in the internment camps, but to come back into society, where ultimately, tragically, he took his own life. As so many, those that were torn asunder in conflict and in wars, it's not just those that lose their lives on the battlefield, it's those that lose their lives coming back home that never left the battlefield. And so I want to just express my deep respect and admiration on Memorial Day, also to veterans and those that have come back from these more contemporary wars overseas, and also just extend our heartfelt thank you and deep respect and acknowledgement to the challenges, travails, and struggles that so many of our veterans continue to have as they come back from those horrific experiences in combat and other experiences, noble experiences related to their service at war. And so we're here in that spirit, in their spirit, in that light of optimism and respect for the opportunities they have all provided us. And I just want to make a point as we're here to make this point. We not only hold those things dear in rhetorical terms, but in terms of our practices. And I want to just recognize the outstanding practice of leadership that is demonstrable, not just here in Yountville, but in our 8 vet homes throughout the state of California. Over 2,000 veterans in these homes, protected disproportionately so because of the outstanding leadership of our Secretary of Veterans Affairs and his remarkable team and outstanding frontline staff. That is not something every governor in the state of California, or rather across this country, not just in the state of California, can say. The reality is a lot of our veterans' homes have been disproportionately impacted by COVID-19 and the spread of this virus. A lot of our American heroes from World War II, not just the Korean War, Vietnam War, or Iraqi freedom, and other wars that are housed and supported in institutions like this, have been immune from the spread of the virus. Quite the contrary. There have been some horrific headlines and tragic lives lost, and examples where the insidiousness of this disease spread like wildfire through facilities like this across the country. That has not been the case, and I say this cautiously, soberly, not been the case to date in the state of California. Throughout our entire system, 8 hospitals, we have had just 3 patients test positive for COVID-19. We've had a number of staff, but the overwhelming majority of staff, all but 2, have recovered and are back at work. And that's because of the seriousness of purpose that was advanced weeks before California's stay-at-home order was put into place by our Secretary of Veterans Affairs. These facilities are not immune to the challenges that are so often present in the lives of Californians as it relates to wildfires, earthquakes, and other hazards. I think as a consequence, in many respects, of the emergency operation plans that facilities like this and others had already organized and practiced over the course of the last number of years, in particular with so many wildfires, particularly in this region, but also in Southern California, that has hardened people's senses and distilled a real focus and energy around protecting staff, protecting our patients and those we serve, the American heroes that are part of this system. As a consequence, Vito and his team were able to put together 38 specific prescriptive guidelines on infectious disease control, on temperature checks and symptom checks for patients as well as staff. Just coming in here today, you could see the seriousness of this. It's like the TSA times infinity in terms of the number of checkpoints and people that are asking you personal questions about where you've traveled and your current symptoms and your health, doing temperature checks, people wearing masks throughout this facility, and the seriousness of the sanitation that has been put into place. It's because of those protocols that we have been able to protect the most vulnerable Californians. These are folks that are getting therapeutic care, not just recreational support, but assisted living, skilled nursing facilities within these facilities, all levels of care that are being provided to our American heroes. And so I just couldn't be more proud and privileged to have Vito and his team here, but more importantly to have the Secretary of Veterans Affairs here to my right to say a few words and I think to express, I hope, I imagine, as he does so often privately, perhaps a little more publicly, his appreciation to the frontline staff of these facilities that have gone above and beyond to protect some of our most vulnerable and heroic residents of this state and our nation. Vito?
Thank you, Governor. Good afternoon. Dr. Vito Imbasciani, Secretary of California Department of Veterans Affairs. I want to say, first of all, that I'm honored to have the trust of the governor of this great state in running these homes where we create an environment in our 8 homes from practically the Oregon border to the Mexican border, where we try to create a home-like atmosphere where veterans can feel safe and we respect their military tradition and honor them. Probably explains why we have extraordinary attendance.
Same time, for what it's worth, the Washington Monument was built. It was that same year that a gentleman by the name of Mark Twain finished The Adventures of Huckleberry Finn. This facility went up, still maintaining itself as the largest in the United States of America. We've got 8 facilities in this state. Some are as small as just 60 or so. This with capacity that can get to 900, roughly 1,000, roughly 750 people are being cared for currently at this facility. So again, I just want to thank the Secretary, his team, their outstanding leadership, the seriousness of purpose, as I suggest, that they have taken in terms of their mission. And I love that he frames this as a mission and a calling, not just a job and a vocation to help protect these American heroes. Let me extend as well a few updates that extend off the narrative of protecting the health of 40 million Americans in the state of California that reside here. We are now moving through, as many of you know, a variance process in the state as we make meaningful modifications to our original stay-at-home order. Many sectors of the economy in the state of California have already reopened as it relates to manufacturing, warehousing, logistics, retail sector reopening in real time, the restaurant industry reopening, including in this region of the state. Currently, 43 counties out of the 58 counties in the state of California have provided attestation of containment plans and protection plans that allow them to move deeper into phase 2. We are putting more and more responsibility on counties, not only as we move through phase 2, but also into phase 3. We're getting to reopen all sectors of our economy. This is happening in real time, and it's an iterative and dynamic process. And put up, I expect, by later this afternoon and early this evening, as many as 45 counties. We'll expect even more over the course of the next number of days. Our commitment is to continue to work with city and county leaders all throughout the state of California to address their concerns and their particular issues. This process has been remarkably collaborative. There are a few examples that are exceptions in the state of California that tend to get highlighted disproportionately, but I just want to express this. They're exceptions, and the incredible spirit of collaboration and cooperation is demonstrable in the engagement with city and county health directors and city and county elected officials from every part of the state of California. And that includes faith leaders. On Monday of this last week, I made a comment that was picked up by many, but perhaps not as many as I had hoped, that we were working with faith community to advance the efforts to begin to put out guidelines, processes, and procedures to keep the public health and safety of congregants and parishioners. We've been working throughout the diverse, interfaith community and within the diversity of our faith-based leadership all up and down the state, working on the differentiation, the large mega churches versus more neighborhood-style churches, the different styles of pews and sanitation protocols, and synagogues versus working with other faiths. We've been working on those sectoral guidelines, and we are just days away. At the latest on Monday, we will put out those guidelines. So I want folks to know that. I've made that abundantly clear in the last week, but not everybody has picked up on it. But it's so important that folks understand that we deeply respect and admire the faith and devotion and the cause that unites millions and millions of Californians, people of faith and community. And at a time of so much anxiety and uncertainty, faith and that devotion to something higher and better and bigger than yourself becomes even more pronounced and more profound and more important. I grew up in a Catholic family, went to Catholic schools, went to University of Santa Clara University, and I often reflect on how impactful the Jesuits were in terms of my upbringing, Father Cause, and so many others that were so, that have defined so much of my life. And it's just an expression of my deep respect, admiration for people of faith. And I want folks to know we are working to move those guidelines forward, and we expect those guidelines to come out on Monday. And by the way, just for full disclosure, we didn't wait for the CDC guidelines. As many of you know, CDC guidelines haven't even been made public in any meaningful way yet. But we do look forward. We are told that they're coming out today to take a look at those guidelines and see if there's things in there that we hadn't already considered over the course of the last few weeks. One thing we have considered is, as we open up the economy, that the prospect of increased transmissions is self-evident. As people no longer are practicing with the kind of discipline they were, the physical distancing and the like, that we could see incidences of spread and concentrations of spread. And we need to be prepared for that. And part of the attestation plans that are required of counties, those 43 to date, are that they have to have the ability to toggle back and address the virulent spread of COVID-19 if indeed the numbers bear that out. Hospitalization capacity, testing capacity, appropriate levels of PPE, protocols and procedures that keep their communities safe and healthy. Let me just give you an example of a county that continues to be of concern in the state of California, a county we care deeply about, and that's Imperial County. I mentioned just a few days ago, and I've mentioned it in previous occasions, we've been watching Imperial County as a county that's not densely populated, but is really one of the most beautiful counties in the state of California. And it's a county that has resources, but often those resources are stretched. They have a few hospitals in that county. Currently, those hospitals are stretched because of a number of people that have ended up that have COVID-related concerns into that hospital system. We've sent out a team, and we are putting a field medical station in Imperial County, up to 125 beds to help decompress their hospital system. They've been utilizing ventilators. They were up to 70+% of their ventilators in use last week. I mentioned that on a few separate occasions. Today it's about 52%, but we're making sure that we get down there with appropriate PPE and make sure that our CalMat teams are present, as well as CalGuard is present. So it gives you a sense of the kind of deployment that you may see in the future if we start to see some incidences of spread that cannot be contained, particularly in communities that don't necessarily have the resources of other communities. It's an expression of this, expression of faith and devotion to this cause as well, of your public health and the virulence of this disease. And look, we're at a facility that stood, Sentinel facility, that stood up in 1918 and 1919 through another pandemic and an influenza outbreak. And there was a second and third wave in that pandemic. There were elected officials and leaders that were the anti-mask brigade, that were disgusted by the idea that people would appear so weak by having masks, as opposed to the strength that I think is the symbol of wearing a mask. So many of the tenets of that history, they say history doesn't repeat itself, but it certainly rhymes. We need to be students of that history. We're at a facility that lived through that history. And so I just want to caution everybody as we move through Memorial Day to appropriately spend time, reflect on American heroes and the cause of freedom that united each and every one of them, the purpose of Memorial Day, and spending time with family, that we also do so in a thoughtful way, and that we are cognizant of not only our loved ones, but the reality of the spread of this disease. We saw an increase in the number of positive cases yesterday in the state of California. We saw 88 more human beings, 88 more families torn apart because of deaths related to this virus in the last 24 hours. So if you, by any stretch of the imagination, think just because the sun has come up and there's a sense of optimism that there's more light, not just in the surrounding environment, but at the end of this proverbial and figurative tunnel, those are proof points. But there's also another reality that is stubborn, and that is the virulence of this disease remains, and lives are continuing to be lost, even here in the state of California, that has done so much not to experience that huge increase in cases, and actually is and continues to experience a decrease in terms of total number of hospitalizations, total number of people in ICUs. And as I do in these press conferences, let me say, I will remind you again that we are holding strong in that becoming more and more of a trend line, that we're not just seeing stability with hospitalizations and ICUs statewide, but we're actually seeing declines, 7.5% over a 14-day period in hospitalizations, 6.1% decline in total number of people in ICUs. And by the way, those numbers are more significant than they may appear in this respect. Those come off relatively stable numbers over the course of many, many weeks. Remember, we're not coming off a peak and seeing precipitous decline. We're coming off a relatively stable trend and still seeing some declines in ICUs and hospitalizations. And by the way, those are the 14-day trends, but we also saw a reduction yesterday. But again, I caution all of you, none of us live in the aggregate. Those numbers are in the aggregate. Imperial County is just an example of a community not living in the aggregate. Other parts of the state, completely different conditions, little to no spread, no cases, and that's why these variances are appropriate. And we're very, very pleased by the progress many of those parts of the state are making in terms of responsibly and safely reopening. More to come in that space. Final point I want to make, and that is to update you on two things that are also critical to continuing to make meaningful modifications to our stay-at-home order, and that's our ability to trace, isolate, and quarantine individuals that may have come in contact with this disease. We announced a few weeks ago a partnership with UCSF and UCLA, partnership with the University of California system, to train tracers, to work with our existing infrastructure of close to 3,000 tracers that already exist in our county health system, and to supplement that workforce. The goal is 10,000, the phase one goal, with the capacity to go up to about 18,000 with a second phase goal. We had 500 people that were our first cohort that were trained a week ago. 300 people are in this new cohort, and now we have a workforce of roughly 5% of those that are not in 24/7 jobs within the state of California that will provide us the human capital to get trained and commit 6 months to become part of this tracing corps that will get us to that 10,000 goal. Today we launched California Connected, and that's a PSA campaign to explain people what tracing really is and what it's not, because none of us are naive. I'm certainly not naive. When you get a call from some stranger on the phone saying they work with government, not everybody is pleased to receive those calls. Some may actually think it's fraudulent. Some may just be more reticent to tell the truth about what's going on, or even comfortable of spending a time having a two-way conversation. And that's why it's really important as we train the tracers and build off the existing infrastructure that's been in place for years and years as it relates to tracing other diseases like measles and tuberculosis, HIV and AIDS, hepatitis, again, well established over the course of decades in this state, that we do so anew for COVID-19. And what makes this PSA effort so different is the cultural competency that's part of it. We're reaching out to communities that traditionally have not been reached out to as it relates to infectious disease control. Translating not just documents in multiple languages, but getting trusted messengers from within communities to let folks know that it's in not only their interest, but their community and their loved ones' interest to work with these trained professionals and provide information in a confidential manner. None of this information is shared. None of this information will ever, ever leave the vault that is a public health frame. This is all about mitigating spread and allowing us to move to reopen our economy much, much faster than we otherwise would. So while testing has substantially improved, and by the way, 1.5 million tests have now been conducted. Those are PCR tests, not the antibody tests. There's some states, lovingly I say this, that are conflating the antibody tests and PCR tests. We're not. Those are just the traditional swab-based PCR tests that you've become well accustomed to in the media and maybe personally for those of you that have been tested. Our testing now is averaging over 45,000 tests a day. The good news, the positivity rate is holding steady. Why does that matter? I'll remind everybody, it's foundational. As you exponentially increase, and remember, we were doing 2,000 tests a day just 6 or so weeks ago. Now we're doing over 45,000 tests a day. When you increase the number of tests, you're going to, by definition, likely see an increase in the total number of positives. What we look at, though, is percentage of people testing positive to those, the denominator, that have been tested. We have been about 4.1% positivity rate over the last 7 days. That's very encouraging. It's been 4.4% if you pull back over a 14-day period. But those positivity rates are holding steady even as our testing substantially improves and increases. And I say improves, not just increases, because the improvement is where we're doing the tests, focusing on rural parts of the state, getting more testing facilities in Northern California, up into Mendocino, Lake counties, and also within our diverse populations in the state into black and brown communities. The partnerships with OptumServe and Verily have advanced that cause, and I'll continue to remind all of you on covid19.ca.gov. On covid19.ca.gov, you can type in your zip code and you can make a determination of the